All right. Hi, this is Paul Walters, pastor at Lutheran Church of the Master in Troy. I had with me Adam Artzberger. People from Church of the Master will, I'm sure, remember Adam from his award-winning participation in the classic Lutheran Church of the Master stewardship plays. Amazing performances. Adam was a confirmand in the first group of students I had when I first arrived at Lutheran Church of the Master. And I was so proud. About a year ago, I got to go to Michigan State University and watch Adam in his white coat ceremony as he began medical school. So Adam, welcome to our celebrity interviews here at Lutheran Church of the Master.
Hello, thank you for having me. I'm excited.
We are too. So you are just completing your second year of medical school, studying at Michigan State, but in their Detroit campus.
Right, so I just finished my first year actually. So I'm now a second year.
So
studying
I apologize. No offense intended.
Yeah, I am only a 25% doctor. Let's not get too far ahead of ourselves.
Okay.
So studying in Detroit. Obviously the main campus is up in East Lansing where MSU is based. But I went there for undergrad, so I just needed a little bit of change of scenery. So here I am downtown.
Awesome. And so we're on here today to talk about the program you've become involved with, DET Needs PPE. What does that stand for?
So basically, the words are exactly what it is. Detroit Needs PPE, as many people probably know. Wayne County, Oakland County, Macomb County have huge volume of COVID positive patients, and they the hospitals, every healthcare related building and network that's still operating is low on PPE. So
that's masks and hats and face masks and gloves and booties and gowns.
Literally everything. So as for personal protective equipment, so that ranges anywhere from an N95 respirator that filters out the smallest virus particles to a handmade mask. Literally hospitals and practices everywhere out of these things completely because obviously the virus spread is so rapid.
Right. So how did you become involved in the program?
So a couple months ago, when everything was kind of just getting kicked off, I was working with just one other student. We were just doing some smaller things, and there was another group of students that were working on a different project. And we kind of just all started conglomerating and being all right, well, we have masks, but you guys have gowns. Let's try and bring it all together. And then we ended up linking with some students at Wayne State University's med school. And we grew so large and people were reaching out to us from all these different angles that we just decided to give ourselves a name. So DET Needs PPE kind of came to be. And that's how we've been rolling for the past couple weeks. We have established quite a following, and we've done a pretty good job of collecting and distributing all over the state, especially in our metro area.
Well, I saw on your website, I saw you've given away 3,500 of the N95 respirators, 3,500 masks, 21,000 face shields. That's a lot of face shields. And ear savers.
Yeah, so the ear savers are more of an accessory. They came basically out of necessity. So wearing masks all day, lots of these healthcare providers were getting chafing behind their ears. So some really smart engineers that have been working with their 3D printers have been creating these little ear savers, and some people have even been hand making, crocheting some of them, and it's been pulling the mask away from the ears and the back, so there's less chafing. So those are more of an accessory, not actual PPE. But the demand for them has been absurd. Once we started handing them out, people were reaching out to us literally from everywhere. So those we just started counting how many we were giving out because people needed them as if they were a necessity. But
That's
we
awesome.
distributed all sorts of things. We fundraised a decent amount as well, and we've been working with some pretty large pharmaceutical and medical sales companies that have given us huge donations. The 20,000 face shields we distributed last week. We have 20,000 more coming next week, and we just have a list of all of these people that we've reached out to that are kind of waiting for them to come from us. So
that's phenomenal. What So where do you get all, so you get this from donations, you get it from, you're taking handmade masks as well as commercially made masks?
Yes. So the commercially made masks are pretty hard to come by, just like the nature of them. Like the N95 and the K95 respirators are like in such high demand right now
Sure.
that even like it's hard to find a donation for them. So we found like some outlets to like buy some for people who really need them, with some of the donations that we've gotten. But mostly we're doing like handmade masks and like surgical masks. We've gotten decent donations for face shields. We work with a group of women out of Dearborn who are called Angels Wear Gowns, and they've been making like surgical gowns, makeshift surgical gowns and isolation gowns out of like plastic and duct tape. And they've grown so large now that they're even giving like us rolls, and we've been giving them to some of our students who are like social quarantining, and then they've been cutting them up, and then we've been picking them up and distributing them. So it's like basically become this like enormous network of all of these groups in the metro area, who are creating something, and we've kind of like been at the center of it just because we have so many connections to the healthcare system, and we have such like a large like group of volunteers with all of the med students that we have kind of behind our backs.
That is beautiful and amazing and wonderful. And I guess that keeps you occupied and busy during quarantine.
Oh yeah, it's actually kind of funny. I was talking with someone about this earlier, and I was like, thank God for quarantine, because I don't think I would have time to like see my friends or like hang out with people or do anything, because when I am not studying for my classes, I'm driving here to pick up this thing to drop it off to this person. So it's been a bit crazy. So I'm a bit thankful for it.
So is that your big joy in quarantine, that you're able to do all this stuff?
A bit. I mean, yeah, that is my joy. It's also it's a peak and a pit. Obviously, the fact that I do it is kind of sad, because the whole situation. But it's honestly been so incredible, and we've donated to literally so many people. It's hard to like wrap my head around. And the healthcare workers and the social workers that we've been giving to are like so grateful that it just makes it so worth it, and it makes it full circle, and kind of like puts the stamp on like why we're doing what we're doing, and like that we have to keep doing what we're doing, because unfortunately we're kind of still in the thick of this.
Right, because now the hospitals and stuff, their supply chains are doing okay, but you're working to network with nursing homes and homeless shelters and people on the streets and that kind of thing, because those are certainly vulnerable populations too.
Right. So it's been a couple weeks now since we've kind of been going full throttle with this, and what we found is hospital supply chain is pretty much caught up. Most of our connects at like the DMC and some of the hospitals even further out, as far as like Pontiac, they're like, yeah, we're caught up. We have enough N95s. Like whenever our new shift comes in, they all get a new mask. Like we have gowns for everyone. So we've kind of shifted our focus from those places who have like a lot of money behind their backs, have received a ton of donations, to places that haven't received any attention yet, like homeless shelters and nursing homes, things like that, because they're still suffering and they haven't received any help, and they don't have like a huge financial like base under them, so they can't just order 5,000 masks. They just like don't have the capacity to do it. So
if you're sewing at home and want to donate masks to DTE Needs PPE, and listening to this, you can get stuff to me at Lutheran Church of the Master, and I'll get it to Adam. And then he'll take the time off between classes and study, and then drive it to wherever it needs to be, right?
Absolutely. Oh, 100%.
And you'll see in the description of this conversation and in the comments, we'll have links to the website, the DTE Needs PPE website, and to their GoFundMe page. All great ways to help out and to make a difference. And Adam's, I'm humbled and awesome. And I know you want to thank me for my inspiration from all these years, because without me, you wouldn't be doing this, right?
Yeah, that's 100%. There it is.
Absolutely, because it's really, let's just bring this full circle, because it's all about me. No, I'm just kidding. I am so proud of you, Adam, and the doctor you're going to become, and also the caring and compassionate, generous person you are, and it's a beautiful thing to see you doing this. Thank you so much. Oh no, did we pause? Did I die? Are you kidding me? We're unpausing. We had some technical difficulties, but Adam is back with us. And thank you again for all that you're doing, Adam. And you want to say any words to the folks out there?
Yeah, absolutely. I just want to say thank you for having me, one. Two, if anybody wants to help in any capacity, if you'd like to drive things places, if you'd like to make masks, if you'd like to crochet ear savers, reach out to me or Pastor Paul, and he'll get you in contact with me, because I can segue some schematics to you. And if you want to help in any other way, just reach out. I want to thank the people I've been working with. The other med students that I've been with have been truly uplifting to me. I don't think we all would have survived the end of our semester without each other. So thanks to them. And yeah, that's pretty much it.
Awesome. Thank you very much for all you do, Adam. And we'll have links to all this stuff in the comments on the interview. Blessings to you, and keep up the good work, and good luck as you begin and continue your second year of medical school.
Thank you.